Hello, my name is Dr. Atwa, and I'd like to welcome you to our practice and discuss with you several weight loss options that we have.
Bariatric surgery. You probably think it's an extreme solution for people who end up on TV shows like My 600-Pound Life, right? Did you know the typical bariatric surgery patient is a woman between the ages of 35 and 50 and is about 100 pounds overweight? Not extreme at all. Take Sarah, for example. She's a 45-year-old wife and mom of 3 kids. She's 5'5" and weighs 245 pounds. That means her body mass index, or BMI, is 41. That's too high. In fact, anyone with a BMI over 30 has the disease of obesity. Sarah's parents were heavy, and she has always been bigger than her friends. But in the last few years, she has steadily gained weight despite her best efforts. Oh, by the way, she takes medicine for high blood pressure, was just diagnosed with sleep apnea, and her doctor told her she has pre-diabetes. She goes to the gym 2 or 3 times a week and eats a pretty healthy diet, but her weight is now out of control. Sarah wants to be slimmer, but like most Americans, she thinks it's a willpower problem. She has always quietly fought this battle on her own, but is now at her wit's end. The straw that broke the camel's back was when she was too big to get on the roller coaster last summer with her kids. What Sarah doesn't know is that in addition to the frustration she feels about her weight, obesity has put her on a path towards heart disease, type 2 diabetes, and many other life-threatening chronic diseases. Most people think of obesity as a defect of character. People with obesity are often looked at as lazy and undisciplined. That's not the case for other chronic diseases, though, and it shouldn't be the case for obesity. Like cancer or heart disease, obesity is a combination of environment, genetic, and lifestyle factors, and left untreated, it's deadly. Sarah doesn't want to drag her feet until she develops diabetes, has a stroke or heart attack, or worse. So she takes action and asks her doctor to help her find effective treatment. Once she realizes how much her weight is putting her health and future at risk, she considers having bariatric surgery. Sarah's bariatric surgery team talks to her about 2 options: sleeve gastrectomy and gastric bypass. Both procedures decrease hunger and improve feelings of fullness when eating by decreasing stomach size, changing hormones released by the gut, and altering the way Sarah's stomach talks to her brain. Unlike dieting, Sarah's body won't fight back when she rapidly loses weight after bariatric surgery. Over time, her body will find a much lower and a much healthier set point for her weight that she can maintain. After talking with her surgeon, Sarah chooses to have a sleeve gastrectomy. The surgery is done laparoscopically with a few small incisions, takes about an hour to complete, and she spends 1 night in the hospital before starting her new life. 1 year after surgery, Sarah has lost 90 pounds. She no longer takes blood pressure medicine or uses her CPAP device, and her blood sugar is normal. She feels great and still exercises 3 times a week, but can do a lot more in the gym now. She still eats a healthy diet, but her portions are smaller than before. She knows she has to work hard to maintain her weight now, but she has the tools to do it. Most importantly, she has tons of energy to play with her kids and is back to riding that roller coaster. While there are extreme examples of obesity on TV shows, most bariatric surgery patients are a lot like you or someone you know. Regular people who have struggled with their weight for too long. There is safe and effective treatment for obesity, and it's not extreme. Join the 200,000 Americans who take control of their health each year by undergoing bariatric surgery. Obesity can be effectively treated, but you have to ask for help.
So I'd like to introduce you to our teams, myself, Dr. Atwa, Dr. Leung, Dr. Groff, Dr. Khair, and Dr. Barr. I did my residency in Chicago, and then I did a fellowship in laparoscopy, which means we operate with the small incisions. Did a main fellowship in bariatric surgery at the Cleveland Clinic. I've been in practice now for 20 years, performed over 10,000 operations, and have assisted other surgeons on 6,000 cases, both general surgery, laparoscopy, and bariatric surgery. I'm currently the Director and Chief of Surgery at St. Charles Hospital. I'm the Chief of Surgery at Mather North Will. My partner, Dr. Leung, he joined us after he did his bariatric fellowship at Staten Island University. He did his residency at St. John's Hospital. He's an undergrad from University of Pennsylvania. Dr. Groff also joined us after he did his residency at Stony Brook and Southampton Peconic Medical Center. He also did a fellowship in trauma and critical care excuse me, at the University of Connecticut. Dr. Khair joined us after he finished his residency at the MGH in Chicago, and he also is fellowship trained in bariatric and minimally invasive surgery from St. Agnes Hospital in Baltimore. Dr. Barr is part of our medical weight loss team. She takes care of the patients who don't qualify for bariatric surgery or don't want that, and she provides them with medical weight loss options for weight loss. Leslie is our nutritionist. You'll see her before and after the surgery to give you instructions on the diets that we have available. There's a free app that you can download that has a lot of helpful information where you can calculate your BMI and has some recipes, and you can plot your graph for weight loss. So what you're going to learn today is what is obesity, what are the daily challenges, what is it costing you, what are your options for weight loss, and what your next steps are. So the first thing is, what is obesity? Obesity is a disease of excess fat storage with a number of associated diseases known as comorbidities. There's a lot of factors that cause it. It's lifelong, it's progressive, and it's definitely life-threatening and costly. What is morbid obesity? Morbid obesity is defined as 200% of your ideal weight, roughly about 80 to 100 pounds overweight, which means a body mass index of more than 40, or a body mass index of more than 35 with one of the comorbid conditions. So this is the equation for that. If you go, there are apps online or on our website. You put in your height and your weight, and it'll tell you what your BMI is. So normal range of BMI is from 18 to 25. You're overweight when you're 25 to 30. You're obese when you're 30 to 35. Severe obesity is from 35 to 40. Morbid obesity is from 40 to 50. And super obesity is above 50. So who qualifies for surgery? Patients with a BMI more than 35 with a medical problem, more than 40. Those are the patients that would qualify for weight loss surgery. If your BMI is between 30 to 40, you would qualify for the balloon therapy for weight loss. So this is the cycle of obesity. When you're obese, you have a negative self-image, you start to get into social isolation, you start to eat to feel good, and you become more obese, and it gets into a cycle, a vicious cycle actually, and it gets worse and worse with time. And there's a lot of obstacles. What happens when you're overweight is it cuts your life by 10 to 12 years, lowers your quality of life, and there's a lot of obstacles and severe life disadvantages. There are a lot of factors. There's a myth that if you were overweight or obese, that you're the cause of it because you don't exercise, you're not disciplined, or you're lazy, and that's not true. There are about 50 factors that cause obesity. The most common ones are, number one, genetic. If you have relatives that are obese, you'll be obese also. Second one is behavioral. How do you eat when you're sad? Do you eat when you're stressed? Do you eat when you're happy? And then there's the environmental, is what you're exposed to when you go to a restaurant. There's a lot of options. A lot of them are very unhealthy or large portions. And the healthy options are usually more expensive. So it's more difficult to maintain a healthy lifestyle with all these options. The problem with obesity is it affects mostly organs in your body. A lot of these problems are caused by being overweight. So type 2 diabetes, hypertension, high cholesterol, sleep apnea where you snore at night. And what happens when you're snoring is it cuts the oxygen off to your brain. And then when you get up in the morning, instead of feeling refreshed and ready to go, you're fatigued. And when you're fatigued, it increases your appetite, and you eat more, and you get into another vicious cycle. It causes depression, incontinence, high risk of cancer, both in men and women. A lot of patients have reflux disease. They have arthritis because you're walking around with an extra 100 pounds, putting stress on your joints, and back pain. It can cause heart disease, fatty liver. In the past, it used to be fatty liver or cirrhosis is caused by hepatitis or alcohol abuse. Now it's caused by obesity. Heart attacks, stroke, infertility, and even with the recent COVID-19, 70% of patients that were sick with COVID were obese. So as you can see, it affects almost every organ in your body. So just one disease causes all of these problems. And you're not alone. It's basically an epidemic right now. It's even worse than the COVID epidemic. About 65% of adults are overweight or obese. 30% of children are obese. 5% of U.S. populations are morbidly obese, which means they qualify for surgery. And the medical cost of obesity in 2003 was $75 billion. This is up to $150 billion now. And in the past, there were 325,000 deaths a year caused by obesity. Now it's up to 400,000. And if you look at this graph here, in 1991, the incidence of obesity was about 10 to 15%, and now in 2008, it's about 25 to 30%. And every year they plot this, it's getting worse and worse. And you face a lot of obstacles and prejudice. They say that obesity is the last accepted prejudice. Simple things like tying your shoelaces or going up the stairs or going to the movie theater or going through the subway. All these are obstacles that you're faced every day when you're overweight. If you look at this graph here, this is the normal death curve here for people at normal weight, 18 to 25. As your weight goes up, so does your mortality or death rate. And also all these medical problems here, diabetes, asthma, arthritis, high blood pressure, and cancer, as your weight goes up, so do all these medical problems. And that's the reason we want to treat this disease. It's the #1 leading cause of preventable death. It used to be smoking, now it's obesity. 50% of cancer deaths in women are caused by obesity, 30% in men. Diabetes is caused by it, and this is a new epidemic, which is diabetes and obesity, called diabesity. Sleep apnea is caused by being overweight. Heart attacks, high blood pressure, 400 deaths a year, and it cuts your life by 10 to 12 years. So the good news is losing about 50 to 70% of your extra weight may help a lot of these problems. It doesn't treat it 100%, but it's a pretty high rate. Your quality of life has improved about 95% of patients. Mortality rate is down by 90%. Migraines are better, 60%. Depression, 50% is better. High pressure in your brain is better. The sleep apnea gets better. All these problems here, the diabetes, hypertension, high cholesterol, that's called the metabolic syndrome. A lot of these improve. Asthma gets better, the fatty liver gets better. Reflux, we treat at the same time. The polycystic ovarian syndrome, the incontinence, venous stasis, arthritis, and gout. All these medical problems improve after you lose the extra weight. Now, there are a lot of other options to lose weight. #1 is dietary intervention. And what happens, most people have tried a diet before. They lose 10, 20 pounds and they gain it back again. So the success rate is very low. It's 0.05%. And the reason for that is when you're dieting, there's this fire in your brain says, I'm hungry, I can't do this. And so you may lose weight and gain it back again. Exercise is a great thing, but it's hard to lose 100 pounds just with exercise by itself. So exercise is important to keep the weight off, but it's hard to lose that much weight with exercise alone. Behavior modification may work for a while, but once you stop it, it comes back again. Drug treatments can help, maybe 10, 20 pounds, and we do that for patients that don't qualify for surgery or aren't morbidly obese. But again, it's hard to treat somebody that's morbidly obese. The best and the most successful option for weight loss is the weight loss surgery with the lifestyle changes that we're going to talk about. So again, here's the success rate with medications, with the band, with the sleeve, and the bypass. And this is how much weight you would expect to lose. With the medical treatment lifestyle change, less than 10%. With the sleeve, it's about 60%, and the bypass is about 70%. So why are we so overweight now? If you look 20 years ago, you go out for a muffin and some coffee, it's about 250 calories. Now, if you go to Starbucks and Dunkin' Donuts, a muffin is 500 to 600 calories. And if you get a Frappuccino or coffee, it's another 350 calories. So you get about almost 1,000 calories. And this is pure sugar. There's no nutrition in this. And so you're overfed and you're undernourished. Who owns Jenny Craig? Nestle. They also own Kit Kat, Haagen-Dazs, and Cookie Crisp cereal. So, with this company, if you want to gain weight, they'll help you. If you want to lose weight, they'll also help you. This is this gentleman's idea of exercising and walking the dog. The guy's going to the gym, so instead of taking the stairs, they're taking the escalator. These little things really make a difference, parking at the end of the parking lot or taking the steps instead of the escalator or the elevator. All these little things add up and really help you to maintain a healthy lifestyle. So who qualifies for the weight loss surgery? If your BMI is more than 35 with a comorbidity or more than 40, you have to be healthy enough to undergo the operation, show that you've tried to lose weight in the past, no drug or alcohol addictions, no uncontrolled psychological problems, and you're seen by several doctors, and everybody agrees that surgery would be the best option for you. But you have to be dedicated to lifestyle changes and follow-up. Other reasons that people want surgery, they want to cut down the number of medications they take. They want to improve the quality and health of their life. They want to have more energy and mobility. They want to be able to get around, play with their kids, and live life to its fullest. They want to get down to a certain weight or size. They want to live long enough to see their children and grandchildren grow, and they want to feel better about themselves. Now, is bariatric surgery a safe option? If you look at all these operations that we do, this is the weight loss surgery, the gallbladder that we do every day, hip replacement, bypass for the heart. The safest operation out of all these operations is the weight loss surgery. And why is that? Because we have you see several doctors to make sure that you're in the best condition for the surgery. What we should be scared about is not getting the surgery. What happens, this is your death rate without surgery. This is what, it's even less than that, 0.1%, even less than that. This is for the weight loss. The same with heart. If you have heart disease, you don't get the surgery. This is your death rate. This is with the surgery. So you have to weigh the risks and the benefits of the operation. What are the options? In the old days, you used to make a big cut. You're in a hospital for a week. It takes you 6 weeks to recover. We don't do that anymore. Now we do the small little incision with the laparoscope or the robot. The operation takes anywhere from half an hour to an hour, depends on the operation. You're in the hospital for a few hours and you go home the next day. The very minimal pain, worst pain is the first couple of days. You feel like you did 100 sit-ups and you're back to yourself within 7 to 10 days. Less risk of infection, less hernias, less pain medication requirements, and you're back to your activity within 7 to 10 days. So these are some of the problems that can happen with any abdominal operation: bleeding, pain, pneumonia, complication from the anesthesia, or blood clots, but they're extremely rare. These are the most common operations performed in the U.S., about 250,000 bariatric cases. And the most common and the safest is the sleeve gastrectomy, followed by the bypass. The band we're not doing anymore, actually taking them out, converting them to another operation. We're seeing more and more revisions, and about 2% of patients are opting for the balloon. So the first and the most common one is the sleeve. So this is your stomach here. It's the shape of a pineapple. We go in with the small little incision. So we staple across here, take about 80% of the stomach. You lift with the small tube that looks like a sleeve. So what happens, you take a few bites and you feel that you're full. This part of the stomach that we take out, it makes a hormone called ghrelin. The ghrelin actually increases your appetite. So when we take it out, your appetite is decreased and you actually have to remind yourself to eat. And that's why this is 95% successful losing weight compared to dieting, which is less than 0.05%.
Gastrectomy is a restrictive procedure, which limits the amount of food you can eat by reducing the size of your stomach. To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. Surgical instruments are passed through the trocars to access the abdominal cavity. The surgeon examines the abdomen using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes to help break down the food into a more simple form, so that it can be more easily digested and absorbed once in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 to 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. The newly created gastric sleeve is able to hold approximately 1/10 of what the stomach was able to hold before. This smaller stomach sleeve restricts the amount of food you can eat before feeling full. The bile and pancreatic fluids from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or post-operative adjustments necessary for the sleeve gastrectomy. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure. All surgery presents risks. Weight, age, and medical history determine your specific risks. Ask your doctor if bariatric.
So these are some other problems that can happen with the sleeve. It could be blood clots, wound infections, reflux, but again, they're extremely rare. These are some celebrities that have had the surgery. Rosie O'Donnell, Mariah Carey, Oprah Winfrey. These are some of my patients that have had the surgery. And again, I mean, they look great afterwards, and some of them look like supermodels, but we're not doing these operations for cosmetic reasons. We're doing this for health reasons, so you can live a full life and be healthy enough to enjoy yourself. There's another patient of mine a few months after the surgery. Next operation is the gastric bypass. It's been around for about 50 years, and what we're doing is, this is your stomach here, and we staple across the upper part of the stomach. So you have this little pouch, so you take a few bites, you feel that you're full. Then we bring the intestine from below, we staple across here and bring it up here. So what happens, the food goes through here, it goes through the intestine, but there's no acid or bile to digest the food. So the food goes through here with no breakdown, there's no absorption. The acid and bile that's normally produced in this part of the stomach comes down, mixes with the food further down, and starts to break the food down. That's when you get the absorption down here. So this operation works by two parts. Number one, it restricts the amount of food that you're eating. And number two, it decreases the absorption of food. So again, here's your normal anatomy. Here's your esophagus, stomach, eat the food, gets broken down by the acid and the pancreatic juice and the bile, and gets absorbed in the intestine. With the bypass, you're rerouting the food away from the stomach, so it goes through here, and then here's where the acid and the bile starts to break down the food and it gets absorbed down here.
Gastric bypass is a restrictive and malabsorptive procedure that results in fewer nutrients and calories being absorbed. It reduces food intake by cutting and stapling the stomach to make a small stomach pouch. The small intestine is cut, and the lower section is directly attached to the new pouch. Food then passes directly into the lower portion of the small intestine, bypassing most of the stomach and upper intestines.
So again, these are some problems that can happen with any operation: hemorrhage, leak, ulcers, dumping syndrome. If you eat something with a lot of sugar, like a soda or chocolate, it'll increase the fluid in your intestine, give you some cramping, you feel lightheaded. So it's a reminder not to be eating a lot of, or drinking a lot of sugary drinks. You always have to take your vitamins with any of the bariatric surgeries. Other minor, extremely rare problems that can happen. And these are some celebrities that have had the surgery. This is Star Jones. You see, look at her before and after. It looks like a completely different person. Al Roker, Randy Jackson, Aretha Franklin. And these are some of my patients. And this patient, he had diabetes. He was a truck driver. He was unable to function. Once he lost all the weight, he had a lot more energy, and he was able to move around a lot more. So revisional surgery is getting more and more common. It's about 15% now of operations. So if you've had weight loss surgery before and you've either gained the weight or you haven't lost enough, so we have different options. We don't just jump to a revisional surgery. First, we do a whole reset. We start all over as if you're a brand new patient. We make sure that you're on a healthy diet, so you see the nutritionist. We make sure that you're exercising. And the best thing to do is 1 hour, 5 times a week, half an hour cardio and half an hour weights. We get an upper GI just to study the anatomy, see how everything looks, and we do an endoscopy to see if what everything looks like. We can also try medical weight loss first and see if that's helpful in order to bring your weight down. And if we've done all this and still you're not able to lose the weight that you're supposed to be at, then we can think about surgical revision. And the options are, if you have the band, we can take the band out and convert it to either a sleeve or a bypass. If you have the sleeve, if the sleeve is enlarged, we can do a re-sleeve, or we can convert it to a bypass, or we can do some kind of increased malabsorption called a SADI procedure. For the patients that have had the bypass, we can do something called a lengthening procedure, where that limb, the part of the intestine that we did for the malabsorption, we can bring it a little bit further down to increase the malabsorption. So this is one of my patients. She had a band that was taken out and was converted to a sleeve. And again, so they look great afterwards, but we're doing this for health reasons. There's another patient that had a band. We took it out and converted it to a bypass. And you see her; she looks great, but she does CrossFit 5 times a week, and she's incredible. I mean, the most important thing after the surgery, in order to be successful, is you have to do the exercise. And exercise is great for everybody, but specifically to keep the weight off. Dr. Barr, she does the medical weight loss for patients that don't qualify for surgery or don't want surgery, or people that have gained some weight after the surgery. So she has several options of pills or shots or meal replacements. And another option we have is the balloon, the Orbera balloon.
Long-term weight loss. The Orbera balloon is a soft, expandable balloon that is placed in an outpatient setting. During a short procedure, the patient is comfortably sedated as a highly trained Orbera physician inserts the uninflated balloon through the mouth using a flexible camera. Once the balloon is placed in the stomach, it is inflated until the approximate size of a grapefruit with sterile water called saline. The balloon remains in the stomach where it takes up space, slows the digestion of food, and encourages proper portion control. After 6 months, it is deflated and removed in a similar manner. Orbera provides an effective non-surgical weight loss solution for those that have struggled to lose weight. Orbera is the #1 global leading weight loss balloon and is used in over 80 countries. Orbera has been shown to amplify patients' weight loss efforts and lose 3 times the weight of diet and exercise alone. To learn more about Orbera or to find a specialist near you,
So these are the different options for weight loss, and the most successful one is the bariatric surgery. So which procedure? You want to think long-term, which one fits into your lifestyle. Don't base it on what you hear on the internet. Most people that have had surgery and are successful, they're out there enjoying their life, exercising and living life to its fullest. They're not online complaining about it. So the surgery can definitely help improve and change your life. It helps resolve a lot of the medical problems that are caused by obesity, cuts down your death rate, and cuts down the healthcare utilization and the healthcare costs. But you have to understand it's not a silver bullet. It's a tool that helps you lose that 80 to 100 pounds, but keeping that weight off is with exercising and with eating healthy. So as you can see, obesity does affect every organ, and with the weight loss surgery, we're able to improve your quality of life, cut down your death rate, and improve a lot of these medical problems. So you've done the first part by watching the seminar. We'll get the okay from your medical doctor before the surgery. We'll sit down and see which operation is best for you. You're seen by a psychiatrist or psychologist. You see the nutritionist. The bariatric coordinator will verify your insurance. Most insurances cover the procedure. We'll do some labs and x-rays before the procedure. And you're seen by several doctors, the lung doctor, the heart doctor, if need be. And we'll try just to get you in a proper mindset before the surgery. Make sure you lose some weight, start exercising, quit smoking. And we perform the operation. Like I said, it's a very quick operation. And it's remarkable that an operation that takes half an hour, 45 minutes can change all these medical problems and have great benefits. You're in the hospital for a few hours, just overnight. We get an x-ray the next day. We start you on some liquids and advance your diet. Right after the surgery, you're a little sore, but I want you to get up and walk around. We'll put boots on your legs and heparin so that way you don't get blood clots in your legs. Follow-up, you're seen a week after the surgery. And then for the first year, you're seen every 3 months. After that, you're just seen yearly, just to make sure that you're on track and you're taking your vitamins and you're exercising, doing everything right. The lifestyle changes, diet afterwards. At the beginning, you're eating small portions, low calories, high protein. You want to avoid liquids with meals. Exercise, this is the most critical thing. And you want to do that to maintain muscle mass and maintain the weight loss. And so you want to do 1 hour 5 times a week, half an hour cardio, and 30 minutes of weight training. So cardio could be a brisk walk, elliptical, treadmill, anything that gets your heart rate up, bicycle, spin class. And you don't have to do it all at once. You can do 10 minutes here, 10 minutes there. Weights, either at the gym or at home. There are some apps. Some of them are free. Some of them pay a few dollars. But this is the best investment in your life. There's Fitness Blender, that's free. SquareKit, it's either free or a few dollars a month. And Beachbody also is another app that you can download. You want to avoid smoking, Motrin, aspirin because it can cause ulcers. You want to avoid alcohol because a few sips can make you really drunk. It has a lot of empty calories. You want to avoid not calling your surgeon. If there's any problem, call us at any time. Avoid pregnancy the first year and a half after surgery. And most importantly, also, you have to take your vitamins every month. And it's about anywhere from $10 to $25 a month. So surgery is the most effective way for sustaining weight loss and resolution of the health problems that are associated with morbid obesity. It's only a tool, and it helps in combination with the healthy lifestyle changes in order to keep that weight off. The majority of patients do very well. About 90-95% of patients do very well, and they say they usually should have done this 10 years ago. I didn't know that this would be such a success. And I would be happy to see you and take any questions. Thank you.